When providing perineal care to a female resident, which direction should you wipe to prevent infection? A. From anus to urethra. B. From side to side. C. In a circular motion. D. From front to back. Answer, D. Wiping from front to back prevents the transfer of bacteria from the anal area to the urinary tract, reducing the risk of infection. A resident with dysphagia is at high risk for A. Dehydration. B. Constipation. C. Aspiration. D. Insomnia. Answer, C. Dysphagia, or difficulty swallowing, increases the risk of aspiration, which can lead to pneumonia. Before helping a resident out of bed, the CNA must first A. Ask another CNA to assist. B. Check the resident's care plan and ensure the bed is locked. C. Position the wheelchair near the foot of the bed. D. Offer the resident food or water. Answer, B. Reviewing the care plan and ensuring bed and wheelchair safety is crucial for safe transfers. A resident becomes combative during care. What should the CNA do? A. Restrain the resident immediately. B. Call 911. C. Stay calm, step away, and report to the nurse. D. Argue with the resident. Answer, C. Safety is the priority. Stay calm, avoid escalation, and report the behavior. The CNA is feeding a resident who suddenly begins coughing and turning red. What should the CNA do? A. Encourage coughing and alert the nurse immediately. B. Perform the Heimlich maneuver. C. Continue feeding slowly. D. Offer water. Answer, A. Coughing indicates partial airway obstruction. Encourage coughing and notify the nurse. What is the purpose of a draw sheet? A. To keep the bed dry. B. To help lift and reposition the resident. C. To warm the resident. D. To prevent bed sores. Answer, B. Draw sheets help reduce friction and assist with safe repositioning. Which of the following is a sign of hypoglycemia? A. Flushed skin and slow breathing. B. Cold, clammy skin and shakiness. C. Vomiting and high fever. D. Severe constipation and fatigue. Answer, B. Hypoglycemia symptoms include sweating, shakiness, and confusion. A resident with Alzheimer's is agitated. The best approach is to A. Argue and correct them. B. Leave them alone until calm. C. Stay calm, redirect gently, and ensure a quiet environment. D. Restrain them. Answer, C. Calming techniques and redirection are effective for managing agitation in dementia. A pulse oximeter measures A. Blood pressure. B. Heart rate. C. Blood sugar. D. Oxygen saturation. Answer, D. A pulse oximeter assesses the oxygen level in the blood. When measuring liquid intake, which is most accurate? A. Estimating with a spoon. B. Weighing the liquid. C. Using a graduated measuring container. D. Counting sips. Answer, C. Graduated containers provide accurate fluid measurement. Which of the following is considered a legal responsibility of a CNA? A. Prescribing medications. B. Changing sterile dressings. C. Reporting suspected abuse. D. Diagnosing conditions. Answer, C. CNAs must report abuse, it's a legal and ethical duty. Which statement about charting is correct? A. Use correction fluid for mistakes. B. Only record what you think happened. C. Document only after your shift. D. Use black ink and chart only facts. Answer, D. Documentation must be clear, factual, timely, and in black ink. If a resident complains of pain during a range of motion exercise, the CNA should A. Encourage them to continue. B. Stop and report to the nurse. C. Ignore and finish the set. D. Apply more pressure. Answer, B. Pain during ROM may indicate injury. Stop and report. What is the best method for identifying a resident before giving care? A. Ask another resident. B. Check the room number. C. Use the ID band and ask the resident to state their name. D. Rely on memory. Answer, C. Always confirm identity with ID and verbal confirmation. A resident refuses care. The CNA should A. Force the care for safety. B. Skip care entirely. C. Respect the refusal and report to the nurse. D. Get another CNA to help. Answer, C. Residents have the right to refuse care. Always report to the nurse. A contracture is A. A temporary joint pain. B. A permanent shortening of muscle. C. A form of arthritis. D. A dislocated joint. Answer, B. Contractures result from lack of movement and can become permanent. When recording a resident's weight, you should A. Weigh them after meals. B. Always round to the nearest 5 pounds. C. Use the same scale and time each day. D. Ask for the resident's guess. Answer, C. Consistent measurement conditions ensure accuracy in weight tracking. Which of the following can CNAs do regarding oxygen therapy? A. Start oxygen. B. Adjust flow rate. C. Remove tubing for cleaning. D. Observe and report issues with oxygen use. Answer, D. CNAs cannot initiate or adjust oxygen, but they monitor and report. When dressing a resident with right-sided weakness, the CNA should A. Undress the weak side first. B. Dress the strong side first. C. Dress the weak side first. D. Start with whichever side is easier. Answer, C. Dress the affected, weak, side first to reduce strain and discomfort. A resident on fluid restriction becomes thirsty. The CNA should A. Give small amounts of water secretly. B. Report the thirst to the nurse. C. Offer juice instead. D. Ignore the complaint. Answer, B. Fluid restrictions must be followed precisely. Inform the nurse of the resident's needs. What is the first step in any emergency situation? A. Provide CPR. B. Run for help. C. Check the scene for safety. D. Call 911 immediately. Answer, C. Ensuring the scene is safe prevents additional injuries. What is one purpose of a partial bed bath? A. Clean the resident's feet only. B. Promote circulation and prevent infection. C. Only to relax the resident. D. Prepare for surgery. Answer, B. Bed baths help maintain hygiene and prevent infection in bedbound residents. How should soiled linens be handled? A. Shaken to remove dirt. B. Placed on the floor temporarily. C. Folded neatly and reused. D. Held away from your body and placed in designated hamper. Answer, D. Soiled linens should be held away to prevent contamination and disposed of properly. When a resident is NPO, this means A. Nothing by mouth. B. No protein only. C. No physical activity. D. Nutrition provided only at night. Answer, A. NPO stands for nil pro os, meaning the resident cannot eat or drink. A resident with a hearing aid reports they cannot hear. What should the CNA check first? A. The battery. B. The resident's ear. C. The nurse's schedule. D. The care plan. Answer, A. Battery failure is a common reason hearing aids stop working.